My name's Dr. Janelle Carreras-Montgomery, and I'm the newest plastic surgeon member here at Ocala Plastic Surgery. I'm originally from Miami, Florida. I did undergraduate education at Boston College, go Eagles. Then I actually came back to Florida. I went to University of Florida for my medical education, so I got my MD at Gainesville. And then I did 5 years of general surgery training in Dallas. After that, then I started on my plastic surgery journey in Detroit, where I did my full 3 years of residency. And most recently, I was in New York City, where I did an aesthetic surgery fellowship. And here I am now in Ocala. Coming and meeting the staff at Ocala Plastic Surgery, they are a family, and I'm very excited to be joining their family as well. And everybody is just so helpful and so supportive. And I'm very, very excited not only to be part of Ocala Plastic Surgery, but to be part of this community as well. I currently do all areas of plastic and reconstructive surgery, so really anything from head to toe, whether it be somebody who was in an accident and had some kind of facial trauma, in skin cancer reconstructions, breast reconstructions, even abdominal wall reconstructions, or really anything that happens to the lower extremities. My passion is aesthetic surgery, which is why I did my extra year of training in that field. So I really do like the artistic aspect of everything, again, from head to toe, whether it be a brow lift or a facelift or breast augmentation or a breast lift, mommy makeover, just really overall making people feel their 100%. We do also offer, and I personally offer, a lot of non-surgical procedures here at Ocala Plastic Surgery. And that goes everywhere from our wonderful estheticians who can take care of your skin, give you facials, or I can do multiple laser resurfacing of face, scars, tattoos, and then, of course, neuromodulators. Everybody knows it as Botox, but Botox and fillers. I really try to be hands-on with my patients. This is a journey for both you and me as the surgeon. I love to see the patients smile when they first see themselves in their first post-op visit and they look at themselves. And even though they're still swollen and they don't look as good as they're going to 3-6 months down the line, you change this person's life just because you make them feel better about themselves. I don't use a cookie cutter approach. I also try to empathize with the patient, and I think most patients really feel that. We really try to work together to come to a mutual decision as to what I think is best and safest, but also in line with what they're looking for. I chose plastic surgery because I was really drawn to the artistry of the specialty. I did not grow up always wanting to become a plastic surgeon. I actually kind of fell onto this life path right before I entered undergraduate education. And I remember distinctly, I was watching Discovery Health Channel, and there was an episode of a little girl who had Treacher-Collins syndrome, which is a congenital deformity that children are born with, and it causes facial deformities. She was IQ-wise 100% there, very smart, very intelligent, very aware that she was very different from everybody else around her. And the episode was basically her journey through all of her plastic surgery procedures to get her back to looking what she should have looked like had she not been missing bones in her face, or having smaller bones where they should be more prominent, getting her back to looking more like her peers. And at that moment, I believe I was going into the School of Business, and I decided, no, this is what I'm going to do. I'm going to do plastic surgery.